to speak this morning. Alone is a national organisation that enables older people to age at home. In 2023 alone provided support to over 36,000 older people, and we have staff and volunteers in all 96 community healthcare network areas. We are also part of the work of the Enhanced Community Care Programme nationally. To make the most of the time allotted to us, we will first speak on the home care legislation and then on home care and related needs of older people in the community from Alone's experience. To provide context, Alone is a founding member of and provides the Secretariat to the Home Care Coalition. The Coalition is a group of more than 20 charities, not-for-profits, campaigners, including organisations who work with older people, people with disabilities and people with long-term illnesses, and organisations working directly with carers and groups working in the primary care sector. Alone and several of our colleagues in the sector believe that the recommendations of the Law Reform Report on the legal aspects of the professional home care produced in 2011 still hold some validity. Some of these should be considered as part of the review, if not already considered. For several years, the Home Care Coalition has met quarterly with the Home Support Reform Team in the Department of Health. We've provided various inputs to various areas relating to the statutory scheme through meetings and through consultation processes. Recent coalition representatives have also met with the Department DCEDIY for the first time in relation to the disabilities and PA services. While Alone welcomes the bill in terms of the beginning of the licensing of home support providers, we acknowledge that we are behind in delivering statutory home care support schemes. We do have concerns in relation to the regulations which will be underpinned by the bill. We have been informed by the Department that the regulations are now largely finalised, are in legal drafting, and we hope the committee can also consider the draft regulations as part of the process of pre-legislative scrutiny. Concerns were raised through consultation process in relation to the regulations by the Home Care Coalition, which include wording. A minimum education requirement was removed from the regulations. We're informed that the reason for this removal was to allow for keeping the door open in order to future-proof the regulations in terms of new qualifications. In our concern alone that this offers a loophole in home support providers not to have a minimum educational requirement in place. Minimum education and training for home support workers will provide an acceptable level of service, should be a minimum requirement of a regulated sector. Secondly, the regulation does not apply to home support service with 3 or less service users provided by a person. While recognising the difficulties that regulating this entails, we believe this will enable constituents of informal care whereby carers to 1 to 3 people can continue to work unlicensed and unregulated. We therefore remain open to exploration of the pay and terms and conditions of those availing of this care, and will also be at risk regarding the standards of care they received. To the best of our knowledge, and as per the regulatory impact analysis published alongside the bill, there are currently no plans to regulate home care. To speak this morning, workers on a private individual basis in this way. Other concerns we have in relation to home support schemes and developing of the statutory scheme include the work of the Strategic Workforce Advisory Group, which has been hindered by the recruitment freeze in the HSE. There has been no progress reported on their own recommendations, and that there should be a significant increase in the proportion of home support hours and packages provided directly by the HSE. Delivery of an equitable statutory scheme will not be possible where there is an over-dependence on the private sector providers. In addition, the process was flawed in that there was no benchmarking of the number of workers at the start of the process versus now. So we do not have accurate information on what the situation is regarding workers. The commissioning process for home support is problematic in terms of offering any level of security for not-for-profit providers and workers. Not all not-for-profit providers work under precarious conditions because of all not-for-profit providers work under precarious conditions because of how the HR commissioning works. As soon as a client goes into hospital or residential care, the provider, and by extension the worker, stops getting paid. The tender pricing model last year, by virtue of not funding travel expenses and only partially funding travel times, ensured that private providers are increasingly only taking on clients who are close to the workers, where workers are based. Otherwise, the services become loss-making. This impacts rural and hard-to-reach areas and high-traffic urban areas. HSE workers, by virtue of the tender, get first right of refusals of a client, giving them more than 40% of the market. Those they refuse tend to be the harder-to-reach clients and outside normal working hours. The HSE does not provide for weekends or overnight. The home support service has moved away from the traditional care, such as basic cleaning, changing of bed sheets, etc. This service is vital to older people who are physically frail. We have seen a significant increase of older people looking for support with these basic tasks, but cannot afford private cleaners. This significantly impacts on the people's quality of life as their housing conditions and welfare decline. Despite multiple reports by the Department of Health, there has been no reports relating to identifying a suitable funding mechanism for home support. We are concerned by reports of a fair deal scheme for home support, such as the given the extensive bureaucracy process of the fair deal. Currently, our home support services operate mainly on trust. There is no regulations, no standard, no independent oversight, and very little data. So any progress must be welcomed. According to the Social Care Institute for Excellent Home Care Services are often inexperienced as impersonal, inflexible, underfunded and poorly integrated. Not designed around the older person, but independent, but dependent on organisational structures who is providing the service. As we welcome this bill to take the opportunity to urge the committee, the department and the government to consider health and social care supports of older people more broadly and to support the design of services with the needs and rights of older people centre to the process.